Okay, so doctor, we're going to start with you. In the most basic way, can you explain to us what Lyme disease is?
Sure. So Lyme disease is an infection spread by a tick. It's caused by a bacteria called Borrelia burgdorferi, and it's really now thought of as more collectively. You know, they used to think that it was just Borrelia burgdorferi, but now they're finding it's a mix of infections, and it has a few groups of symptoms in general. It can cause neurologic problems like headaches and sleep disturbance and problems thinking. It can cause musculoskeletal problems like muscle pain and arthritis and joint pain without swelling. It can cause cardiac symptoms like heart failure, which is what my dad had. And it can cause constitutional symptoms, so fevers, being really tired, things like this.
So it's summer, and this is when I would imagine the tick population starts to boom, and a lot of people become diagnosed with this. Is that right? Is this sort of like the hot season for Lyme disease?
Anytime over 40, when it's over 35, 40 degrees, the ticks become active.
Okay, so spring, summer for us.
Yes.
So I go up to my house in upstate New York. I'm walking around. All of a sudden, later that night, I start to scratch something on my leg. I notice I have a bite. Is this the way this starts? Is that typically the way that people realize that something's up?
Believe it or not, it's typically not. Most people don't recall a tick bite. Most people don't recall a rash, unfortunately. I wish they did, because if they did, they can get treated earlier, and early treatment is associated with a better prognosis. So for people who get treated early, that's the best chance of getting over it and not having recurrent symptoms. But for even in those early stages, the relapse rates are in excess of 20%.
So they don't recall. They don't remember being bit by something. They don't know where it happened.
Yeah.
So what's the first inclination that something's wrong?
Well, when people start to feel sick, it's usually a mysterious kind of a situation. They have flu-like symptoms, they think it's the flu, then the next day it gets better. So typically Lyme comes and goes on its own. So they say, oh, I'm over it. And then 2 weeks later, they're sick again. And then they get a headache and a stuffed neck. And then they go to the doctor and they say, oh, you must have had a bug. Give it a few days. It's that type of thing. It's so kind of insidious. It's like the frog that slowly gets boiled and doesn't jump out of the pot. So the unfortunate thing is people will turn around 6 months later and it's kind of this pattern, and their functional status is such declined, they go, what happened to my life? And that's what I usually see in my office. People kind of, mourn for their prior life and how they were. Without
realizing exactly what happened or what got them to this point.
Yeah.
How is it typically treated, at least in the initial stages?
With antibiotics, and the doctors kind of fight on how long and how aggressively Lyme disease should be treated. So there are 2 medical societies that have very polarizing views on Lyme. One's called IDSA, which stands for Infectious Disease Society of America, and they advocate for a shorter term treatment. The other's called ILADS, which stands for International Lyme and Associated Disease Society, and they advocate for a kind of case-by-case treatment. For the people who don't develop chronic symptoms, they advocate for a shorter treatment is okay, and for people with longer term and recurrent symptoms, they advocate for longer term antibiotic therapy.
Why is there such discrepancy about Lyme? Why is this such a controversial illness?
It is by far the most heated controversy in medicine, in my opinion, and in many doctors' opinions. And there are reasons that are scientific, and there are reasons that may be less than scientific. The scientific reasons are that the bacteria that causes Lyme has been and will continue to be very difficult to culture from the blood of animals and people who have Lyme. So if you give a dog Lyme, and you know that dog has Lyme, when you try to isolate the bacteria from its blood, it's not like a throat culture. You can't just simply grow it. So we can't tell who has it and who doesn't. And the tests that are used to diagnose Lyme are 40-year-old tests, which have very poor accuracy. So we have bad tests to diagnose it, and once it is diagnosed, we don't have a test to show that it's gone. And we know in animal studies and in human studies that they find the bacteria after even long-term antibiotics. So whereas you can't grow it from the blood, when you cut the animals up, they have Lyme in them. And they have Lyme after months of antibiotics, including the IV antibiotics. And in human studies, they've even isolated Lyme from humans up to even 2 years of antibiotics. It's been done.
But it's quite prevalent. I was reading that there are 300,000 new cases of Lyme diagnosed each year in the United States. 300,000.
Yeah, 300.
That's not a one-off.
No, 329,000 is the estimate by the CDC. And to put that in perspective, that's more than new diagnoses of HIV and invasive breast cancer combined. And think about how many studies are done for those illnesses. And with the high relapse rates of Lyme disease, again, at least 20%, we're talking 20% of these 320,000 people every year have become chronically ill. And there are only 3 NIH-funded trials of treating, placebo-controlled trials to treat antibiotics in this patient population. And it's kind of ridiculous. I mean, with the studies of breast cancer and HIV, there's study after study after study, and Lyme patients that are chronically ill get 3 studies over a period of 16 years.
I mean, it's not only ridiculous, it's dangerous. It's life-threatening.
I think it's egregious. I mean, we can use very large words. It's a horror show.
Is it because Lyme disease on its face isn't sexy? It's not that it's not the hot disease of the week. There's not a senator standing up championing this, fighting for it. There's not these news stories and dramatic video from overseas like we've seen with a lot of other chronic illnesses and major epidemics. Is that part of the problem, that there's no sort of distinguishable face or profile of this?
Right. So I guess sexy is a relative term. It's true that there's no distinguishable face, because you can have people that are infected with Lyme that get no symptoms. And it's also well documented that people can die from Lyme within a matter of weeks, even young, healthy people. And then we have this whole in-between. So with such a big spectrum, this heterogeneous presentation, how do you know, like you said, the face of Lyme? What is the face of Lyme? I get patients come in, they say, my doctor says I'm too sick to have Lyme disease. I say, well, Lyme can kill people. How could you be too sick to have Lyme? And the next patient will come in and say, I'm not sick enough. My doctor says I'm not sick enough because I can still play tennis even though I feel like crap. I can still, run. So everybody has a preconceived notion of what Lyme disease is, and there isn't any such thing. This stereotype of bullseye rash, Bell's palsy, Lyme arthritis, about stereotypes. I mean, it represents a minority of the population. It's not the majority picture. Majority picture, they present as fibromyalgia, chronic fatigue syndrome, rheumatoid arthritis, multiple sclerosis, and these are kind of sexier illnesses because they each have a distinguishable face. So it's not like it's like Lyme is the many-faced disease, so you can make it sexy in that way. It doesn't have one face, but it has many faces that are characteristic in its different presentations.
And what I've heard it called is the great imitator, but it's the great actor, it seems. It can manifest in so many different ways, present itself with so many different symptoms.
Right. So, and I think that words have meaning. And the word imitator implies a lack of causation, but if it mimics and imitates MS 100% and imitates rheumatoid arthritis, and that everyone knows that Lyme was first thought to be an epidemic of juvenile rheumatoid arthritis. Do you know that to this day they haven't done a single study on antibiotics with juvenile rheumatoid arthritis, placebo-controlled, to see if it gets better? And meanwhile, that's what Lyme first presented as. And it's interesting that they've done 11 studies with rheumatoid arthritis in adults, and they've shown that antibiotics help rheumatoid arthritis and placebo doesn't. They've compared it to placebo by itself. They've compared it where they added on to methotrexate, which is a chemotherapy drug that's a standard rheumatoid arthritis treatment. And when methotrexate was failing, antibiotics helped and placebo didn't. Then they did another study where they added it to methotrexate plus steroids, and that was failing, and the antibiotics helped and placebo didn't. 11 studies is a lot when you're talking randomized placebo-controlled, and yet antibiotics are not really promoted for rheumatoid arthritis. Instead, the things that are promoted are these powerful immunosuppressive drugs, the biologics, they're called. And why aren't they doing studies comparing antibiotics to the biologics? I have lots of patients that fail biologics that come to see me, and I get them better with antibiotics. And that's my experience in my practice.
It is such a fascinating thing, because I think if you look at the number of people who actually have this illness, and to the uninformed, they might say, well, I'd rather get Lyme disease than be diagnosed with MS, right? But when you look at how this is actually presenting itself and the long-term effects and the damage that it does not only to a person, but also to everyone around them, and how it can, I would imagine, even ruin a family with the amount of stress that it puts on a family. I mean, it's really pervasive.
So Lyme is a very cruel illness because it takes people out at the prime of their lives. Young, previously healthy, 20 and 30-year-olds get stricken down, end up in wheelchairs. And in terms of saying people would rather have Lyme than MS, I always say to people, it's like saying, do you live in New York? Do you live in the United States? Do you live on planet Earth? It's like yes, yes, and yes. So if somebody with Lyme develops brain lesions and spinal cord lesions and inflammation of the nerve that goes to the eye, called optic neuritis, and the typical things, they're called oligoclonal bands on the spinal fluid, all of those things are reported with Lyme. So there are many studies showing that, wait a second, Lyme can be clinically indistinguishable to MS. We can't tell the difference. So they say it mimics MS 100%. But if something is mimicking MS 100%, then it's causing that patient's MS. That's what I'm saying, where words have meaning.
Right.
Imitating, mimicking, causing. And this is the thing that I think has to be hammered home, that it's quite likely that Lyme causes a very significant percentage of MS patients. There was a study out of Europe where they isolated Lyme from the spinal fluid of every MS patient in the study and not from the healthy people, and that was largely ignored. There are 3 randomized placebo-controlled studies of treating MS with antibiotics, and it works. The MS gets better with the antibiotics, and that's not publicized. It's only these very expensive immunosuppressive drugs that takes the limelight.
I was just having a conversation on Saturday night with a very good friend of mine who is a researcher at Yale, specifically studying MS. And I asked her, because a friend of ours just was diagnosed, and they were telling her she can have a normal, healthy life. And I said, but MS doesn't have a cause. She says, well, for the most part, no, it doesn't. But what you just said contradicts that. MS could have a cause, and that cause could be Lyme disease.
Everything has a cause. Whether or not it's found yet or not, that's the distinction. For example, Parkinson's. Parkinson's is Parkinson's until they find a cause for it, and then they call it Parkinsonism. They have Lyme-induced Parkinsonism. Bartonella has been shown to cause, these are all other infections that are
Right.
tick-borne. There's another one related to Bartonella called Brucella. They know that can cause Parkinsonism. There are many things that can cause Parkinsonism, but before they find the cause of it, they call it Parkinson's. The same with MS. MS is demyelination. It may be like the top of a pyramid, and maybe Lyme is one part of the base of the pyramid, and there may be others. The same thing can be said for Alzheimer's. It's very kind of timely because a big article just came out from Harvard, and it just came out a couple of days ago, where they found that amyloid, the protein that's implicated in Alzheimer's, is actually a response to infection in the brain. And for a long time, Lyme has been linked to Alzheimer's. They found Lyme bacteria from brain autopsies of the brains of patients with Alzheimer's. So it may be that it's a multitude of infections that are causing Alzheimer's. And again, Lyme is on one of these bottoms of the pyramid. But to look at these things as a definition, like, okay, this is Alzheimer's, it's mysterious, and we're never going to get to the bottom of it, some doctors are satisfied with that, and I never have been. I don't look at these as diagnoses. I look at these as descriptive kind of syndromes. Yes, this is Alzheimer's. Yes, this is MS. Yes, this is rheumatoid arthritis. It's just one word or 2 words to describe something that would otherwise require 20 words, but that brings you no closer to finding out what's going on with you, truly.
Let's talk about chronic Lyme.
Yes.
Does chronic Lyme exist? Is it a real thing?
It's absolutely a real thing. When you have isolated Lyme bacteria from patients, humans, after years of antibiotics, no one can say, that's post-treatment Lyme disease syndrome. So there's this theory that is promoted by certain factions of the medical community that these very high failure rates of Lyme disease are a post-infectious syndrome called post-treatment Lyme disease syndrome. And it's the exact same symptoms as Lyme. And critics of that will say, why would you make up a second disease that has the exact same symptoms as the first disease? That is the most idiotic theory ever. And if you ask anybody that's not a doctor, they say the same thing. So, if they never isolated Lyme from people with chronic Lyme, I would say, maybe it is post-infectious. If they never isolated Lyme from animals that failed antibiotics, I would say, maybe it is post-infectious. But the fact is that the newest research out of Tulane, Johns Hopkins, and Northeastern University shows we can't even kill Lyme in the test tube with the antibiotics that they thought were curative in the body.
But even the CDC doesn't seem to subscribe to that. Even the CDC seems a little bit, I guess, leaning toward the gray area of things. If the government can't even decide that this is a real thing, how is the medical community ever going to come together and say, no, we believe these patients who say they have this chronic lifelong illness?
In my opinion, the CDC hasn't actually been that gray. I think they've very much lent themselves to believe at the post-treatment Lyme disease syndrome. They seem to be aligning themselves with that theory, and I think that it's wrong. And it's very difficult for people to speak out against things. We all want to be in the majority. It's easy. But the CDC did a study. It was published a year ago, and they just polled general doctors. How long are you treating Lyme disease? Are you treating it for the 1 month or less, which is advised by the IDSA, or are you treating it longer, which is advised by ILADS? And 56% were treating longer. So the majority of doctors, just general doctors, are not following IDSA guidelines. They may not say it publicly. They may not want to be Lyme disease doctors and face all this controversy, but that's what they're doing. And that's the reality of things as by the CDC's own data. So it is a mystery why they're not coming around. I don't know. I don't understand it either.
It's insulting to the people
It's
who
infuriating.
legitimately have these diseases.
It is. It's infuriating. My patients come in, and for the first half hour, a lot of times, I have to calm them down from their prior experiences with other doctors. And they always ask the same question, why is this going on? And I say, I don't know. Doctors are a stubborn bunch. I don't get it either. But who knows? I read a neuroscience article the other day on how people change their opinions. Turns out it's not about data. Because when I give these talks about chronic Lyme, I give so much data, like study after study after study, where they found that the NIH did a study where they took ticks that are clean ticks that grew up in the laboratory not to have Lyme. They put them on people with post-treatment Lyme disease syndrome, and the ticks got infected from the patients with post-treatment Lyme disease syndrome. It made no news whatsoever. Okay, it was an NIH study. It was completely buried. It should have been front page on the New York Times. So we don't change our opinions based on the data. We change our opinions based on personal experience. When a doctor gets chronic Lyme, and so many doctors have come to see me with chronic Lyme, then they believe. But a compelling and kind of scary statistic is, although I've treated at least 100 doctors with chronic Lyme, only a few of them will treat Lyme disease themselves with long-term antibiotics. They send all their patients to me. They won't get involved, even though they themselves have been sick with this illness.
Not knowing anything about that, it seems to me that there is something else at play here.
It seems to me that there is too.
Something else, maybe there's a pharmaceutical company involved, or something else at play as the only explanation why no one will stand up at a high level and say this exists and we need to treat it.
Well, it's interesting to say that, because this is the crux of the issue. I have presented at multiple state testimonies, all throughout New England. I've presented in Connecticut, I don't know, maybe 5 times, Rhode Island, Vermont a couple of times, New York a few times. It's always the same thing. They ask me to say, what's the evidence of chronic Lyme? I give my PowerPoint, bring in some articles, and they usually send a representative from the IDSA there. The irony is that data that documents chronic Lyme, a lot of it was written by the IDSA's own guidelines authors. So on the one hand, they say the data doesn't exist. On the other hand, they wrote it themselves. So it's very embarrassing. I pointed out, you have to, I have to do my job to make sure that the patients, their rights are protected. And they usually ask the IDSA representative, what is going on? And there's not a good answer. How could you say something doesn't exist, but you're the people that proved it in the first place? There's no answer.
So Dana, you listen to this. I see you nodding your head, shaking your head, almost in disbelief, because part of this is your story.
Right.
So tell me, from your perspective, first of all, hearing a lot of this, the fact that people believe that this doesn't exist, the fact that people don't believe that you actually have the illness that you have.
Right.
I mean, essentially what they're saying is maybe you're not telling the truth.
Well, I had heart failure. So I had an actual test that could show that my heart was at 40% function. So, and I had a rash that you could see that was migrating, and I did have symptoms that you could tell clinically were true and that were really going on. I think that it's extremely disturbing. I think it's extremely corrupt what's going on out there. I mean, there's just too many people out there that are suffering in the same way that I did for it to be some weird conspiracy. I mean, patients are telling the truth. I know that I was telling the truth. I was at the prime of my life, just like he was saying. He has lots of patients. I'm a songwriter. I'm a singer. I just signed a deal with Sony, a 3-year deal. It's a very big deal in my world of music.
In anybody's world.
In anybody's world, but certainly, doing what I do, it's a very big deal to get these kinds of opportunities. And right before I signed the deal, I was bitten, and my whole body went haywire. So I remember very clearly, like, walking up to sign my deal and not being able to take a subway anymore because I was too anxious to. I've been living in New York for a long time. Could not be on the train, couldn't be around a lot of people. My anxiety was like off the charts. And you know, I had sort of every manifestation of Lyme. I had heart, my joints hurt, my limbs, my fingers and my toes were tingling. I had anxiety and depression and insomnia. So I was kind of, you know, checklist case. I mean, when I finally did discover what was wrong, it was by going down this online, this doctor named Dr. Burrascano, who came up with this long checklist of 60 symptoms. I had 38 of them by the time I saw Dr. Phillips. So I was in pretty bad shape, and I had gone to 11 or 12 doctors in New York City. I kept going to infectious disease doctors. I kept asking if it could be Lyme. They kept saying no. And I kept saying, well, then what is it? I don't know. Your blood tests look fine. We don't know. Maybe it's going to be MS. Maybe you have fibromyalgia. Maybe, we don't know, you know, but it's not Lyme. It's maybe post-treatment Lyme disease syndrome.
They said unequivocally, you do not have this.
Unequivocally, you don't have it. I have doctor's notes to prove it. I mean, it's kind of insane. It's kind of insane. And I was pressing them. You know, I was not sitting there wallflower just taking anything they said. I kept saying, but I just had Lyme. I had a bite. I had a bullseye. I was treated for a couple of weeks. It didn't seem to help. I seemed to get worse after that. And, you know, they said I couldn't possibly have it. And it didn't make any sense to me whatsoever. I just kept seeking. I mean, I wasn't going to stop. They told me, you know, I went to an oncologist, I went to 3 infectious disease doctors, I went to cardiologists, I went to internists, I went to a sports medicine guy because I was so weak I couldn't lift a fork. You know, I made the rounds in New York, and I was very, very, very strong about my opinion that something was wrong and that I wasn't going to just leave it. So finally, 5 months in, I Googled all my symptoms, which I really didn't want to do.
I mean, you WebMD'd it, basically.
I diagnosed myself. And then I was on vacation in California, found a doctor that was a Lyme specialist, agreed to see me on vacation, was very kind, knew immediately that I had Lyme, and then I came back and started treatment with Dr. Phillips.
How did that doctor know immediately, though? I mean, if 11 other doctors didn't know that you had this, then how does this one know immediately?
Because he's a specialist, and because that's what people need to know, is that they should not be going down this rabbit hole. They shouldn't be going to all these other doctors. If you think you have Lyme, if you've ruled out other things, cancer, all kinds of other diseases, which I did, you need to go to a Lyme specialist, and it has to be specifically trained for Lyme by ILADS. This doctor was trained, and it's really a clinical diagnosis. The blood tests that we have to diagnose Lyme are very poor. They're like 50% accurate at best, so you really can't trust them. I don't even know at this point if I've ever had a positive Lyme test, but I did get better with Lyme treatment, and on a very, you know, steady, incremental basis. Including my heart function, which is 100% normal now. So what I would say to doctors who questioned me, I even went to a rheumatologist after this because I had some joint swelling and we just wanted to have him take a look at it. He said, you know, there's no such thing as chronic Lyme. I don't know what you're talking about. I don't know what you're doing. He looked at my records. This is crazy. And I said, well, how do you explain the fact that I got better with Lyme treatment? Like, how do you explain the fact that I was half dead a year ago, couldn't get out of bed, couldn't breathe, couldn't walk? And how do you explain the fact that I feel 95% now with Lyme treatment? He said, I can't explain it, but I'm glad that you're better. And I said, well, do you want to know, do you want to talk about new studies? Do you want to talk about research that came out of Johns Hopkins proving persistence of Lyme? He didn't want to talk about it, and he didn't want to hear about it. So this is what Lyme patients are up against, and a lot of times we're really too sick to argue. And, and a lot of people trust doctors too much, and they don't trust their intuition, so they don't keep looking. And they just lay down with this MS diagnosis, or this fibromyalgia, or this Parkinson's. I could have gotten any number of those.
I'm thinking about all the people that didn't have the willpower, the intelligence, the access to resources, the strength, the physical strength to do what you did.
I was mad. And I think sometimes being fueled by anger, you get more done than anything else. I was very angry because I knew that I wasn't crazy. I mean, you know your body. What I say to patients now, and I get lots of contact from people from all over the world telling me, well, my doctor said that it's rheumatoid arthritis. Well, find another doctor. Keep going. find a Lyme doctor, no matter where you are. You can find somebody in this country. Unfortunately, in other countries, it's not the case, so they come here. But I was just enraged, and I'm still enraged, which is why I'm here, because I really want people to understand that they need to advocate for themselves.
It is crazy to think that a tick bite stole your life.
Stole my life, derailed my life, and I'll never be the same. Even though I feel really well right now, I'm forever changed. I will never trust doctors again, except him. I will never, I will, you learn a lot of lessons when you get sick like this. You learn to trust yourself, you learn to rely on yourself, you learn to follow your intuition, and you learn to just keep fighting and to not give up. And you find a reserve of strength that you never knew you had.
So doctor, you're treating Dana?
Yes.
So when she says she won't be the same again, medically speaking, is that accurate?
Well, we don't know. We don't have the crystal ball. I run into patients all the time, and I get cards from patients. I've been in practice 20 years, so I've had patients, contact me many years later, or I run into them at Home Depot, or whatever, and I say, you 100%. And I've heard that. But more commonly, I hear that they're not. They're like 97 or 96. Every so often they say, I'm just about to call you. I feel like it's coming back. And then it kind of goes away. And there's probably a small reservoir infection left in them, but it's enough for the immune system to keep in check. They have their lives back. But like Dana said, they are still irrevocably changed. And part of that change is physical, and part is the horrible experience they went through trying to get the diagnosis and treatment that they needed.
And the potential of relapse for the rest of your life. I will never stop looking over my shoulder. I will never stop. If I wake up some morning with some strange symptom, my toe is a little bit numb, I will never be able to blow that off again for the rest of my life. So this is going to be hanging over my head until there's a cure. And right now, we don't have a cure. We're lucky if I'm in a very lucky category of people who actually got better. But I'm not cocky about it. I totally realize that at any moment, anything could happen. I could fall and break my leg, and this whole thing could come back. And that's what happens to people sometimes.
Especially if they take steroids. One of my patients, who is a physician, had done very well with treatment, and he had gotten poison ivy, put himself on prednisone, and it started a whole cascade of events down and back into relapse. So prednisone, steroids suppress the immune system, and if you have a little reservoir of infection left over, and you take something to suppress your immune system, it can cause a relapse. And that same thing can happen when you go through a major stress. I've had patients come back, I say, what brings you back? Did you get another bite? No, I don't think I had a bite or anything. I just went through a divorce, and the stress of this divorce it all seems like my Lyme is coming back. And I hear that frequently as well.
If you get bit again, if God forbid, you get bit again and it's Lyme again, does that make the situation that much more complicated? And is that a possibility? It sounds kind of strange to think that this could happen again. But would that compound an already tenuous situation?
Sometimes yes, and sometimes no. Most of the strains of Lyme are actually kind of wimpy, and you hear a lot of people, they get over it, it's no problem, they think it's like a summer flu, and this whole debate is overblown. And one of my patients is in that category. I just saw him literally 2 days ago, and his story was it was either 3 or 4 Lyme rashes over the years. He's been in Connecticut forever, and he's always had the 3-week, 4-week doxycycline cure, and he's been fine. And then a few years before he came to see me, he had gotten another Lyme rash. He got treated with doxycycline, and he wasn't fine. Then he started developing all sorts of symptoms, and neurologic and neuropsychiatric symptoms. So when Dana says she's not crazy, she's not. But crazy, we should take the stigma out of that word, because people do develop neuropsychiatric symptoms with these infections. It gets in the brain too. It doesn't just get into the heart and the joints, and it gets into the brain. So he started developing irritability, crying all the time, outbursts. They did a spinal tap. His spinal tap was all, his spinal fluid was all inflamed. They said, oh, you have Lyme in the spinal fluid. They gave him the IV antibiotics. It did 0. It was like salt water. He's just as sick afterwards. It didn't help him. Some people it helps, some people it doesn't. The IV is not always better than the orals. In fact, the studies don't show that it is. When they compare doxycycline even to the IV, the outcomes are the same. And he had a long treatment. He's much, much better now. But he always kind of thought Lyme was nothing with nothing. But every time you get a bite, it is Russian roulette. Yeah, your next bite could be mild, more mild than your first case, or it could be markedly, markedly worse, and your life will be irrevocably changed, and that's a done deal, unless you get treated.
So from the physician perspective and from the patient perspective, what can the rest of us do? What do the rest of us who do not have Lyme, or that we know of, what can we do to bring awareness, to help, to understand, to comfort those that are in this position?
I think, like Dana said, know your body, and it's hard to look. So it's hard for doctors to speak up against and say, look, the CDC, this agency that is charged with our well-being, in my opinion, is not helping in the way that they should be helping. It's hard to speak up and say that.
I can say that.
But no, I do say
strongly,
it too.
yeah.
But it's just hard to speak up. It's also hard just in a one-on-one to say to your doctor. A lot of patients are intimidated, and they don't have the relationship with their doctor where they can say, wait a second, what you're saying doesn't make sense. You know, because my patients will tell me post-treatment Lyme disease syndrome doesn't make sense. What was my doctor talking about? And I say, didn't you have that conversation with your doctor? And they say, he leaves the room in 30 seconds. I don't have time to say anything to my doctor. I'm like, well,
so you
finally.
advocated a patient saying to their doctor, I think you're wrong. I think you need to go back and recheck the manual because maybe you're not right with your diagnosis.
The problem is the manual's not right.
Yeah.
That's the problem. And there are two manuals. There's the IDSA manual and the ILEDS manual. And patients should know about both. People are largely rooted to the IDSA manual. That is where that's where the CDC is recommending IDSA all the way. They're not recommending ILEDS. And patients need to know
they're suppressing science. They're suppressing good science that shows persistence of Lyme. I mean, it's criminal, really.
But people need to know there was a choice. That you know, when they've done a legal medical analysis of this whole thing, they say, look, there are two standards of care at this point. The patients should be aware of both standards of care. But instead, a lot of my patients, before they come to see me, are told that Lyme is bull. You know, chronic Lyme is bull. This is quack science. You know,
It's voodoo.
Every slanderous term you can imagine, I've heard it all. And, you know, you have to have a thick skin to be a Lyme doctor, and fortunately have a thick skin. And you have to stand up, like I said, for when you know you're right, when the science backs it up, you're right. They always say, you know, you have to do what's right in this world. At some point, that's all it comes down to. And I encourage the patients, like I said, if something doesn't feel right, to look further. Do not take things at face value because it's frequently not correct.
And from a patient perspective?
Well, one thing that I've diagnosed a ton of people since I've had Lyme, actually. It's all around you. It's all around me. I have lots of friends who are my age, younger, who have all kinds of symptoms that they explain away. It's mommy syndrome, I'm just tired, work is stressful. Your joints shouldn't hurt because you have kids, and you shouldn't have brain fog because you're tired. You know, it's a very specific thing. So I think that people should take their symptoms a little bit more seriously and not blow them off, because time is of the essence when you have Lyme in a lot of cases, and the longer it goes on, the more difficult and the more painful the treatment is for a lot of people. I only had it for 5 months, and it was hellacious. So I would say that people really just need to pay attention to their bodies and take their symptoms seriously. And you know, I had a lot of friends during this period who were supportive, but I also had a couple of friends who were like, oh, you know, it's just a little rash, it's a little bite, it's not. No, it's actually not just a little rash and a little bite. It's Lyme, and I'm going to the hospital right now. And that's what happened. You know, you just gotta follow it. And you know what? At best, you're wrong. Great. You know?
Right.
There's some other reason, and it's not a big deal, and it's not Lyme.
But at worst?
At worst? Well, I'll give you, I see horrendous cases every day. I see cases that I have to leave the room because I got to get a tissue. Okay. So one recently, she said I could talk about her case. I'm not going to mention names. This nice woman had a positive Lyme ELISA, which is the screening test, and between 2 and 4 bands on her Western blot, but didn't meet the 5-band reporting criteria, which the CDC says there's 10 times as many cases out there as meet the strict reporting criteria that a lot of doctors go by. And IDSA advocates for using CDC reporting criteria, even though CDC doesn't advocate for that.
Right.
So she had this positive Lyme test, but it wasn't the full reporting criteria. For 9 years, the Western blot was up and down. She said, and her husband, who's an attorney, said, oh, the doctor said this looks just like Lyme. I wish I could treat you. I wish I could treat you, but the test isn't fully positive. She ended up getting severe dementia, not mild or moderate, severe dementia. Her mini mental status exam is very bad. She lost, I would say, 90% of her vision in an occipital kind of blindness. It's a blindness that occurs in the brain, not in the eyeball. She is completely disabled, not just from her job, but every aspect of her life. And so no, it's not always just mommy brain fog and joint pain. I wish it was all like that, but I see the worst of the worst cases, and it's absolutely heartbreaking. And when people come in with mild symptoms that have been going on a long time, you know, it's not something they should have to live with. And but I see the worst of the worst.
Without getting too technical, is there hope for that woman?
Yeah, she's
is there a chance that she will regain some form of normalcy?
So I just started treating her several months ago, and she's starting to improve already. And everyone notices it. People at her church have noticed. Her husband definitely notices. She notices. So yeah, of course there's hope. My mom says when there's life, there's hope, and I believe her.
So you're obviously you have been treating her, and that's the first introduction. But you guys have taken this a step further in order to help people. So what are you doing together?
Well, Dana wrote a very nice, and has been writing a very nice series of articles for the Huffington Post, trying to raise awareness for Lyme disease. I do whatever speaking engagements come my way. Dana's been very good in coordinating those for me. She's very active in the New York City kind of entertainment community. So it's been beneficial in that way.
I get him out of the office as much as I can. Yeah.
Well, what's interesting about it is that there has been such a celebrity spotlight lately on this.
There has.
And I don't know if it's Yolanda Foster with Real Housewives and so many people who watch that show.
It's Yolanda, it's Avril.
It's Allie Hilfiger. It's on and on and on.
Yeah.
Which is scary to think that a celebrity needs to endorse something in order for the rest of us to pay attention to it, right?
I'm just happy that they are starting to kind of come out and talk about it, because I've had a lot of celebrities in my office over the years, and they didn't want to. I've asked them. I said, "Look, we really need a face to this." And they were not willing to talk about their Lyme experience.
But it's not sexually transmitted. This is not
Yes,
something that you should.
it is.
Oh,
actually.
it can be.
It can be, actually.
There's limited but good data that it may be. The CDC frankly says that it's not, but they did a study where they looked at the partners of patients with bad cases of Lyme, and they found that specific strain, the DNA, in each partner. So there's so many different strains of Lyme, there are hundreds. So the odds of having the exact same strain between partners would be very low if it wasn't sexually transmitted.
And pregnancy. During pregnancy, you can pass it on to your baby.
Oh, you can.
You can.
So
I know
there's
many
been-
people who have, unfortunately,
There's
who
been
have
fetal demise.
very sick children or stillbirths.
But it doesn't act the same way as MS does or other sort of autoimmune issues when somebody's pregnant, where they find that their symptoms are actually less or even dormant
No, it
during
does.
pregnancy.
No, Lyme symptoms typically reduce during pregnancy and increase postpartum. Just
With a vengeance.
With a vengeance, unless they're treated during the pregnancy. I've not seen the postpartum flares be bad at all in Lyme
Women should be
patients.
treated during pregnancy if they have Lyme, if they know they have chronic Lyme.
I offer my patients treatment during pregnancy with the caveat that they have not done good studies. We don't know if the antibiotic treatment actually prevents transmission to the baby. It's, like I said, a personal choice. You have to educate the patients. I would say 90% of the time my office is giving data and data and data. And even though the absence of data, saying, look, this is a concern. We know that it can cross the placenta. It can kill a baby. We don't know. You know, the fact is also that most babies seem to be healthy, and even in patients with established Lyme. But there have been some horror shows out there. We all know about them. And it's their choice whether or not to take pregnancy-safe antibiotics throughout the pregnancy.
And breastfeeding. I mean, if I were pregnant and I had a baby, I would not breastfeed.
I also discourage breastfeeding.
Yeah.
Because you're taking an
It's
antibiotic.
transmissible through breast
Just in
milk, I
Lyme
think.
patients, I'm
Yeah.
saying. I think breastfeeding is fantastic. But, you know, if you give birth to a healthy baby and you've gone that hurdle, you know, you went that far. You know, I grew up on formula. Granted, my family is really neurotic, but we turned out okay. You know, I think that it's better to breastfeed if you're healthy. If you have a potentially transmissible illness, I wouldn't. If it was me, if I was a woman, I wouldn't rock the boat. I would say, oh, thank goodness I gave birth to a healthy baby. You're on formula.
Yeah.
All right. Thank you.
All right.
Thank
Thank
you.
you.